Well, good afternoon and welcome to a second daily update here for COVID-19 in South Australia. I'm joined at this press conference by the Honourable Stephen Wade, the Minister for Health and Wellbeing, and Professor Nicholas Spurrier, the Chief Public Health Officer. We don't usually have two press conferences in one day. In fact, it was only a few hours ago that we reported to you that there were just 6 cases linked to this cluster. Unfortunately, we have new cases to report and concerning new exposure sites in addition to that. In fact, we go from 6 cases in South Australia to 12. There will be another 5 announced with regards to the Tenafeate Winery, where we believe this was an exposure site on Sunday afternoon from 1:45 through to 4:30. So 5 new cases linked there and 1 additional case linked to the Greek on Halifax Street. Most concerning is one of the new exposure sites, which is the Gawler and District B to 12 school. And we know that one of the people who is now infected was at this site yesterday. So we will be getting in contact with every person that we can who was at these exposure sites. This is exactly and precisely why we needed to move South Australia into a lockdown situation. In fact, I'm very grateful to the people of South Australia who have abided by the new restrictions since they were announced on Monday. And of course, the lockdown situation that was put in place as of 6 o'clock yesterday. It would have been a very difficult situation if these 6 new cases were out and about in the community. This Delta variant is extraordinarily transmissible, and this disease thrives on indecision. We've gone hard, we've gone early, we've gone with the cooperation of the people of South Australia, and we need that cooperation to continue into the future. We now have 12 cases linked to this site. We don't want to have any more, and that's why we're asking for everybody's cooperation to reduce movement around South Australia and to make sure that we can maintain that physical distancing as much as possible. This is a very transmissible Delta variant case. We've now gone to 12. I'll now pass over to Professor Nicholas Spurrier to provide a further update to these new cases.
Thank you and good afternoon. And as the Premier said, we wouldn't normally do 2 press conferences, and I'm very keen that we do stick to giving you a daily number, because otherwise it is quite confusing to keep up with all of the numbers. But we felt it was very important to let people know. I mentioned this morning that my staff had highlighted to me the Tenafeate Winery as a high-risk exposure site, and having got back to the department, I started to see that there were some cases and that there had been transmission indeed at that winery, and that's at Yattalunga, and the time of exposure when there was an infectious case there was 1:45 to 4:30. And so linked to that now, we have 5 new cases. So that was when the infected case was there, they've managed to infect 5 people. What I can't tell you is how many tests we have done of all the people at that winery, and we will need to do a reconciliation on that. Obviously, it was a popular winery. There is a restaurant, there's an outdoor and an inside dining area. I still haven't got all of the details because these results have come through very, very recently, and the team is taking all of that detailed information from the people that have now tested positive. I'll just give you the ages for completeness. We have a woman in her 50s, a man in his 50s, a woman in her 60s, a man in his 40s, and also a woman in her 80s that have tested positive. Now, one of the things to say about this is because the exposure was fairly recent, which was Sunday afternoon, and also because we were contacting not only cases but secondary cases, people who had QR'd in at the winery received an SMS on Monday night. So that's why we had many of these people were able to go into quarantine quite early. And so my understanding is that the man in his 40s related to the school had attended the school on Monday and then has been in quarantine since then. Now, we do know from the experiences interstate, particularly talking to my counterpart in Victoria, that the time between getting exposed to this Delta variant getting enough virus in your system to infect another person may be as short as 24 to 36 hours. So we are very concerned, even despite that short time interval between the exposure at the winery on Sunday and now these people becoming positive. So we will be doing contact tracing for all of these new cases going back to the time of that exposure. But the most important time will be in the last, will be on Monday, before the time many of these people actually went into quarantine. So sorry if that's a little bit complicated, but just wanted to give you a little more detail. Now, in addition to this, we also have another case from the Greek on Halifax, and that's a young child less than 5 years of age. And I can't give you any further details about any of the clinical status of these people. We'll be in the process of interviewing them, but also transferring them into the Tom's Court Hotel facility. The school community has been informed at the Gawler and District College B to 12. That will be a massive undertaking to get all of the people that we need to have tested. I explained this morning that we do have a risk categorisation in terms of getting a testing priority, and but all of those people that have been at the school will be required to quarantine in the first instance, and then we work backwards through our risk assessment. Just in terms of testing, I have got some news in terms of an update. I indicated this morning that the department executives were working with SA Pathology to set up a dedicated testing facility for people who are at those higher risk locations that we in CDCB want to get them tested as a priority. And we have indeed found a location, and we've set that up, and that's now going to be available for those people. Now, normally I'd tell you where it is, and I'm sure you'll eventually work this one out, but I don't want to have it inundated by people who are just seeking testing for other reasons. So we really do want to use that just for those people that we've prioritised through CDCB. We've also been working closely with ClinPath and ACL to support their endeavours at testing, and we do have now extended hours at Port Adelaide and Mile End with ClinPath, and both of those sites are open until midnight, and I do thank the people at ClinPath and ACL. They have been working very, very long hours as well to make sure we can get this important testing done. I've also been told that Tanunda is looking at getting a second drive-through lane, which is fantastic. And then in terms of Victoria Park, we've had extra staff that have come out of our hospitals today. We've also had agency staff that we're bringing on board and training in terms of our PPE. Just in terms of the facilities for people that are waiting there, I was recently told that there's water being delivered to everybody that's waiting in the cars. There's also a number of coffee vans that I'm told will be on site fairly soon. But just a reminder that if you are needing to use bathroom facilities there or get a coffee, it will be important that you stay your distance from other people, because there are very good reasons for you being there to get COVID tested, and we don't want you getting close to anybody else while you are there. The toilet facilities, I know people were very interested at our previous press conference, and the arrangements are being made to not only extend the opening hours of those under the Adelaide City Council, but to make sure that we've got portable toilets and that there's adequate cleaning of those during the periods of operation. The other thing just to note was that ClinPath and ACL, people might be wondering, well, you're doing, you've got all these things in place to do all the swabbing, but what about all these tests that are coming through? Have we got the capacity to put them through in the laboratory? So we have contingency plans for all our laboratories if we need to send specimens interstate to make sure our turnaround time is kept under very tight control. So I'm very happy to take any further questions on the cases or the testing.
Professor, can I just ask you, please, the group at the winery, are they all of the same group? Are they all of the same party, or are they different people in different parts of the winery? So
I can tell you absolutely, I've given you all the information I've got about all of these cases. I don't know where they were seated. I don't know who was related to whom, or whether they were related to one separate party. This is all the information we've got. These are results that have come hot off the press, but it's really to make sure that we've been open open and transparent with the South Australian community, and just to explain how quickly this can spread, how quickly people can get infected and pass it on without even being aware of that.
Do you have any idea of how many people were at the winery on the Sunday afternoon?
No, I don't have that information either, but the winery's been notified. Obviously, we're using the QR check-in. We'll also be looking at the manual check-in when people have handwritten their name. And just a shout out, please use the QR check-in. It's so hard to read people's handwriting. Make sure we've got those mobile numbers correct. And now people can see how important it is. We will also be getting CCTV footage and looking at credit card details, but those things take time. The quickest thing to do is using the QR check-in.
Professor,
the child that was under the age of 5 at the Greek of Halifax, was that part of the private birthday?
So again, this is all the details I've got. These are very hot off the press, and this is why we tend to only do the one press conference so that we can give you those sorts of details. My team is working very carefully to take those interviews to get that information. But the reason the team is doing the interviews to get the information is for a public health reason. They're trying to work out what other close contacts these people have had so that we can get in front of that chain of transmission.
Professor, just very clearly, what would you like those who were at the Gawler and District B to 12 school yesterday to do tonight or right now?
So they will have received information from CDCB, so they need to follow that information. We will also have information up on our website about it being an exposure site.
Professor, is this a super spreading event, and how concerned are you?
Well, I would say that both the Greek on Halifax and this winery are examples of super spreading events. And yes, it is very serious. I am concerned. I am also very pleased that we were able to put a lockdown in place so quickly. And again, I thank all South Australians for following these rules. It is a time to stay at home and not move. If you don't need to go out, don't go out. Stay at home. I know that we have reasons to leave the home, but just minimise those reasons.
Professor, how many people do you think you still need to track down from the winery and also the Greek of Halifax? Are you confident you've got everyone from the restaurant?
I would need to check those details with my team, but what I can say is we've got very, very busy people on a number of floors in our Department of Health trying to track down absolutely everybody. When we feel that there's potentially a gap, and because we know that not everybody has QR'd in, sometimes you go with a partner and you might have QR'd in but the rest of the family haven't. This is why we are putting information up on our website. So if we have an exposure site, say it was a small GP practice, for example, this just as an example, we might be able to get hold of everybody without putting that exposure site up on our website. But when it is a larger area, such as a winery where people might have just gone in for tasting, for example, may not have QR'd in, then we will put it up as an exposure site. And this is why I've got the press conference today, to really let people know in South Australia, if you were there at that winery and you haven't received an SMS from us, you haven't had any contact from our staff, get tested and put yourself into quarantine. It is so extraordinarily important.
Professor, just with the 5 new cases, do you expect there to be a number of new exposure sites, and when can we sort of expect to see them uploaded to the SA Health website? Yeah,
so the team will be talking to those people at the moment, and the way it works is as soon as we get a case in, we've got our communicable disease doctors, and they make the notification because they need to be the person that tells the patient of their results and check on them in terms of any symptoms, because we need to make sure, of course, that these people are healthy and well and get any required medical care. And then that's passed on to our contact tracers, who do a very detailed contact tracing interview. It can sometimes take 2 or 3 hours to do the contact tracing interview. Given that we've only received these results earlier today, all of that is in train. However, as soon as we get an exposure site, that will go up on our website, so expect to see that expanding. I also just want to let people know that this is presumably a very busy winery, and we know that the Greek on Halifax also had a busy night on the Saturday night. So I think people in South Australia do need to prepare themselves for more cases. That's certainly my expectation. But the important thing is if we can make sure that everybody is in quarantine from the moment that they've had that SMS that they have been at a potential exposure site.
Professor, by way of the capacity now at Tom's Court, given the new cases, how is that looking? And are you now looking prep the extra 2 floors at the Pullman?
So we have a team that run the Medi Hotel system and Tom's Court. So I haven't been in direct communication with that team today, but they are doing a fantastic job making sure everything is prepared for an increasing number of cases.
Professor, you mentioned that
considering there was such a significant jump today, would you expect the same sort of tomorrow and the coming days, and therefore our lockdown to likely be extended for over 7?
Look, it is very difficult to say. We did our lockdown very early. So my expectation is that if we're getting new cases at some point in the future, there won't have been an opportunity for exposure. And this is what I'm saying to everybody. You just don't know whether you could have come in contact with somebody. This is the reason to stay home. If you do need to get some groceries for your household, only have one person go out, have a shopping list and spend the minimal time in that shop. Wear a mask, be really safe and get out of there quickly. If you can pre-order your groceries, order online, then do that, because it's really so important that you're protecting yourself when you go out at all at the moment. The safest place for everybody is to be at home.
Professor, you're opening up a new testing clinic at Lot 14. What's the daily capacity of that site?
I don't have those details. This has just been planned, just been set up, and this is the testing for people at priority risk. So these are the ones that CDCB will be directing to get testing, and we need to make sure that those people get tested promptly, because that's the way we get ahead of this curve.
Is it correct that it can only do 40 people a day?
I don't have those details. That would seem like quite a low number, but I haven't been given any details.
Professor, just of these new cases, have any of them required hospitalisation, or were they, have they all been relatively okay, symptomatic-wise?
Again, I don't have a clinical status update. All I can tell you is this is the number we've got, and these are the ages of the people, and then we're just going to be working through. We'll be giving you a full press conference tomorrow morning, and by that time I will have some more details.
I appreciate, Professor, I appreciate all of your, I appreciate you don't have very much detail, but can I just clarify the case that was already existing, because the exposure site was announced much earlier than now, the current cases were already in quarantine and were caught up in that testing requirement, or?
Oh, so what I can tell you is that on Monday night, an SMS was sent when it was recognised as a potential exposure site to people who had QR'd into the restaurant or the winery. I can't tell you whether that went to absolutely everybody. It would have just been to those people who had QR'd in.
Professor, this morning it was announced that QR codes would be used on public transport, but what about for people who don't have a mobile phone? How will they check in to their particular route?
Yes, so I can't give you the details on that either, but my understanding, having read the direction many times, is that there will need to be a manual way of people being able to check in.
Are all of these new cases, are they now being transferred to Tom's Court?
Generally, that's what we do. It's the safest, because that means that we're protecting the public, but it also means that we can provide a little bit higher level of healthcare as well if people deteriorate.
How's
Professor,
the
can I just?
capacity going in that hotel?
That's not too bad at the moment, given that we've had a reduction in our flights into South Australia. But we, of course, we'll be continuing to monitor that situation.
Professor, could I just ask you, there's obviously been a huge amount of demand on testing clinics today, and we're having reports galore across Adelaide of people being turned away from clinics, including those who say that they've been to exposure sites. In that situation, what is your advice to those people about trying to do the right thing and get tested?
Yeah, so please go back, have another look at our website. We've opened up a lot more testing between SA Pathology, ACL and ClinPath. Have a look at the extension of the times, and please come back. Please come back and get that test, particularly those people who have been to an exposure site. It's absolutely critical.
Professor, are there any sort of exposure sites at the moment you think also could be super spreader events?
Not that I've been informed by my team.
Well,
And obviously, given that we're now in a lockdown, we don't give this virus any opportunity to have a super spreading event.
I appreciate there's lots of information that's come out, Professor. What is your main overriding message to the public tonight about this case, this outbreak and the cluster?
So the main message is, this virus can only move when we move as people. If we stop, this virus will stop and this outbreak will stop. This is why it is so important that everybody stays put. They stay away from anybody else, particularly those people they don't know, but even within your family group, stay in your own home. You might have relatives, and you know, in my instance, I've got an older mother who's at the moment needing additional care. And we've made a decision that it will only be one person in our family that will provide that person that care. Because we just don't want to have a lot of coming and going in different households. So even though it says in the direction, these are your 5 reasons you can leave the home, try to stay home as much as possible. If you've got plenty of food at home, then use the food that you've got at home and just try and relax, try and, you know, think of some hobbies to do. As I said to my husband when I left home this morning, this is the day you can tidy up your sock drawer. Okay, try and think of some things that take your mind off the fact that you're in lockdown.
Professor, are you concerned at how widespread these exposure sites are? Have we seen this before, that they're dotted in so many areas of Adelaide?
I think this is a reflection of the fact that we have been very lucky and have enjoyed a wonderful lifestyle here in South Australia. Many places around the world haven't been able to do this for a very long period of time, so we've been fortunate. So this is really just an example of the fact that people in South Australia do get out and do travel around and do you know, attend these sorts of venues. But you know, now we're in this situation, the important thing is to follow the health advice and please just stay home, just relax and stay away from other people.
And Professor, would your advice be to hope for just a 7-day lockdown, but to prepare for longer?
Look, I think we're at the very early stages of this. I find it better to try not to predict. My job is to provide the very best advice in terms of all of the information that I'm privy to. And I always think about things in public health as being proportionate, but also precautionary. So often in public health, we have to do something quite significant in terms of a lockdown before something actually happens. And it's, you know, it's easy in hindsight to say, oh, perhaps that's an overreaction, or perhaps you should have gone harder. They are difficult decisions to make. So I don't want to predict what the future holds. I just want to wish everybody a safe Wednesday evening. Phone up people, keep in touch by social media, but please just stay away from each other physically.
Professor, on testing once again, there was a new testing facility opened in the north, I think it was at Ridgehaven or in the Modbury area. Is there any reason why that's not going to a 24-hour facility, given how many exposure sites are popping up in that part of Adelaide?
Yes, I think I'm correct on this, that the hours of that will be extended. We're just making sure that we've got enough staff to operate that. And so it's really a matter of having enough staff there to do the swabbing. Yep.
Thank you very much.
Terrific. Thank you very much.
Thank you.